So by way of background, this was a project that we actually completed in January 2020. So that's when the report was published. And as Jen has already said, the work was commissioned by the What Works Centre for Children's Social Care when Michael was there. And this was really a precursor to the work that Michael spoke about earlier. And it was a collaboration between the Alan Turing Institute and the Reece Centre, where I was based at the moment. And essentially, we were asked to conduct a project to answer the question that I have on screen here. So really, is it ethical to use machine learning approaches in children's social care systems? And if so, how and under what circumstances? And as part of the project, we were really tasked with answering these three questions. So really considering about, should we actually be doing this? So should we be using machine learning? Can we do it right? And then making recommendations about what needed to be done, given the impetus towards machine learning, predictive analytics, and essentially that sort of the field and the grounding that we've already discussed this afternoon. So what I've done with the slides today is, rather than doing a complete rehash of presentations that we've done on the project before, given that we published 3.5 years ago, I've tried to do a little bit of reshaping and thinking about the context of what else is being presented today, and also many of the issues that are coming through with different tools being developed and where we are with the sector as a whole. So just very briefly, the work that we were doing was a very small scale study. It was predominantly a desk-based review of the literature, drawing on literature from machine learning and ethics of machine learning and AI outside of the sector of children's social care, and then focusing in on children's social care as well and the use of predictive analytics. We ran a roundtable discussion, and we also did one workshop with families that was facilitated for us by Family Rights Group to speak to families who had been involved with children's social care. And we worked through our project with them and our proposed recommendations, and then refined them following that workshop. So what I'm going to start off with today is to really start thinking about the challenges to ethical machine learning that we identified through the project. Again, many of these challenges have already been discussed or raised this afternoon, so reiterating some of those, but essentially what was driving a lot of the impetus behind the work leading up to us publishing our report was the kind of public management context of austerity. And I think that the majority, or maybe all of us, would actually consider that context of austerity and the current cost of living crisis to have exacerbated many of those issues. And I think it was Michael that touched on this earlier in terms of the concept of value, thinking about cost effectiveness, but also this whole thing around sort of relationship-based practice and how that was essentially at odds with some of the direction of travel around relationship-based practice, and then how that could be conveyed or was being conveyed into some of the predictions coming through from machine learning at the time. Real issues and challenges in terms of thinking about systems, infrastructures. Again, we've talked this afternoon a lot about resources, how much time needs to be invested in thinking about the resources, but the resources to do the analysis, but also the resources in terms of what data exists and how that information can also be extracted and collated from existing systems. Also issues related to cultural receptivity. And again, I'm going to come on to this a little bit in some of the findings in terms of the workshop that we did with family members in terms of how receptive they were to the concepts around the use of their data for predictive analytics. I think one of the biggest challenges and concerns that was raised both in the literature and at the roundtable discussion and through our workshop was about social inequality and cycles of poverty and discrimination essentially being baked in. And again, I think, this comes right back to the beginning of this afternoon and the word cloud and the prominence of the word bias. So again, just thinking about the ways in which the data are being used in machine learning, predictive analytical models in terms of inequalities being baked into what is there. So what we were also looking at is, okay, so if this was going to be done, what are the issues that need to be addressed? Again, lots of this will be familiar to you, so really thinking about data quality and use. And I noticed somebody had put a comment in the chat earlier about, you know, there's a lot of information that exists within children's services case management systems that is in free text fields. So again, just thinking about, well, what is it about the data? Are the data that are being used in these models the data that are easy to extract rather than the data that are the most meaningful to extract? So that sort of really gets into the point about data relevance. Also thinking about measurement accuracy. Again, I noticed earlier on, comment in the chat about information about disability. So thinking about what information is in there and in our systems, and then what gets used. Also the sort of issues in model design, and I did also notice on the word cloud that sort of there were a few references to black box, and I think again somebody has already talked about transparency, real issues in terms of the model design and what's sort of happening in there. And how transparent that is, or is it a case of data being sort of imported and used in the sort of black box technology and then a series of predictions coming out? And linked to that is really thinking about the user interface. So what is the information that comes out of any of these models? And then also thinking about training. So is the training in terms of the use of any predictive analytics and the models and the outputs? So the sort of training in terms of how it can be used. So again, it's something about the translation of what might come out and how social workers or senior managers might use that information. So really focusing in on ethics and what does ethical machine learning in children's social care require? And again, I think just to highlight at this point is our work was focusing predominantly on children's social care. And I think it's really important to focus on that and to reiterate that in the context of the previous presentation and Gary talking about the importance of what they have been doing about early help, which essentially is the sort of the precursor to supporting families before they reach that point or reach the threshold for children's social care. But what we did do through the project, and I suppose what I would consider to be our main output from the work, is to propose a commitment to care, collaboration and understanding. And we developed this as part of the project following a review of 19 different sets of ethical standards, and they were ethical standards for social work and for AI. I'm sure, given the audience, many of you will be familiar with sort of ethical standards for social work, including those by British Association of Social Work, but also looking at the different ethical standards within AI. We mapped across the different sets, the different standards, and identified a lot of commonalities, and essentially sort of honed it into the ethical values, the practical principles, and the professional virtues. And within our commitment, which if you want to go away and have a read of the commitment, which is in the report, essentially there are 4 overarching areas. It's about respect, connection, care and protection. And again, this really comes back to transparency and consent and the importance of children and families consenting to how their data is used. Now, in my last minute, I just want to talk about our recommendations. So from the project as a whole, we had 8 recommendations. And I thought that within my 10 minutes today, having described the project and talked a little bit about our findings, I wasn't going to have time to go through all 8 recommendations. So I have selected the 3 that I thought were most appropriate for our discussions today. Again, just highlighting the importance of inclusive and consent-based practices. I think it's really important to say that the families that we spoke to, and through doing our desk-based review, it wasn't a case of we should not be doing this. It's more a case of if we are going to do this, then we need to do it right. And by doing it right, we need to be inclusive, and there needs to be consent-based practices. I think, again, one of the other things just within the context of this that came up earlier today, and certainly aligns very much with the 6 core principles that were developed as part of Gary's work, but also that what is the the bare minimum that we have to do in terms of ethical guidance and legislation is not enough. That is not necessarily working in a way that is ethically. The other thing I just wanted to highlight here is that, again, a lot of the discourse is focusing on risk, and actually the families that we spoke with in our workshop were highlighting that they were not adverse to their data being used. Again, if it was being used on a consent-based basis, that there was transparency, but actually if there was a focus on improving outcomes and thinking about strengths-based approaches, then they were a lot more receptive to the idea. And I realise the time, so I'm just going to stop there, and I have got the link to the report if anybody is interested. Thank you.